Okay, we're live.
Hey, there we are.
So you might want to just give people a little time right now.
Give me some time. To mute that. Wow.
Don't see no attendees yet because I made them register. So
Okay. Are you gonna let them in and out? Right?
it'll automatically let them in as long as they register with this email, and I'll be able to see who they are.
Okay, did you put it on Facebook?
Yep.
Okay. Can you hear all the noise in my other room?
Yep.
You can?
Yes.
Well, there's 4 people watching now, guys.
Hold, let me. I hope that's better.
Okay, I'm just sharing things out to
Okay,
the
we got
world.
one attendee on. Say hi to Ruth.
Hi, Ruth.
Still 5 people watching on YouTube.
To pop up the chat. Oh, there
Oh, a couple people on YouTube, Janine and Charlie. And remember that YouTube is it's a little bit slower on YouTube than it is on Zoom.
we go. Thank you.
Another attendee registered. Patricia.
We should have had some lounge music.
Right?
Let's see.
Some jazz.
Some smooth jazz.
And then Patricia and Ruth, they can hit the Q&A and type their questions in, any COVID related questions.
Eddie, can they hear you or is it just us?
No, everybody can hear us.
Okay.
At least I hope everybody can.
Right?
Weezy, do you want to just start? Otherwise, it's just
Okay.
painful to watch the replay.
Okay, here we go. We're gonna get things started and then we'll just, we're kind of waiting for some people to pop on. Well, first of all, I guess I'm gonna introduce myself in case you don't know who I am. My name is Louise Isham, and I'm the Senior Executive Coordinator here at Boys Fort. Our special guest tonight is Teri Morrison. She is the community health nurse. It's basically the main person here at Boys Fort for us for information on COVID. And our Simona Benner, she is a director of human resources. I know that there was a lot of questions that were coming in regarding human resource human resource questions and how it relates with COVID and employees. And then of course we have our IT individual, IT Chavers, in the background here to help out with any technical issues. How this is going to work is that we did collect some questions from the community, and we have those up and running. We'll get to those first. Okay, and if you can, if you're on YouTube, there's going to be a little bit of a delay. So bear with us on there. And if you have any questions, you're welcome to ask those in the chat box for YouTube. And if you're joining us as an attendee on our Zoom webinar, down below, there's a panel toolbar that'll pop up and they'll have a Q&A box for you. So if you have questions there, you can input them there and then we'll get to them as we are going. All right. Let's see. So get started. I guess what the first thing I'm going to do is ask some of the questions that came in first. So let's start. All right, Carrie, one of the questions that came in, people are wondering what phone number should they call if they need help or if they've they've been exposed to COVID-19.
If they want to call for testing, I would suggest that they call either clinic. So the Netlake Clinic's number is 218-757-3650. And the Vermilion Clinic is 218-753-2182. And then what's going to happen is if you're going to let the receptionist know that you need to schedule or that you think you were exposed or you think you have COVID, and then they will take your name and then a nurse will call you back and talk through when you were exposed and how long you've been sick. And the reason why we have the nurse call back is because MDH, Minnesota Department of Health, is recommending that if you've been exposed, you get tested on days 5 to 7 from when you were last exposed. If you get tested any earlier than that, you're probably not going to come up positive. So we want to make sure that that you have, it's the most accurate testing time that you have. So that's why you end up going back to talk to a nurse.
Okay. Do we have any quick questions here? Let's see. I'm reading both chats, so hang in there with me. All right. Our next question is, why do you still have to quarantine for 2 weeks if you tested negative or show no symptoms?
Because you could develop symptoms anytime within that 2 weeks. So we want to make sure that you're not going to infect anyone else. So we recommend that you get tested between 5 and 7 days, but that does not mean you get to return to work if you test negative.
Okay. So do you always send out 2 tests?
If you have symptoms, then they will do a rapid test. And that's a test that we run in the clinic, and we usually have an answer within 15 minutes. We only run that if you have symptoms. If you don't have symptoms, it's not recommended that we use that test. So then we would do a send out. Most people, if we run a rapid and it comes up negative, then we will do a send out. We've done hundreds of tests, and I know of at least 4 that came back positive when we did the send out. When we did the rapid, it was negative. And then when we did the send out, their results came back positive. And that's because the send out test is a little bit more sensitive. It picks up the virus better than the rapid one.
Okay, another question that we had was, what is the best hospital in the area to go to if I'm seriously sick with COVID-19?
I think that's kind of a preference. So I've seen in the paper that Cook has the remdesivir, one of the antivirals that they're doing. So a couple of the patients that I've seen that ended up in the hospital have gone in through Cook. Then they've started some of the antiviral medications that they can give there. And then Cook will usually send them out. Cook is not set up to handle. They do not have an ICU. So they will send them out to a different hospital from there, but they'll start the treatment there.
Another question is, so what if a person in your household is positive? Do the others in your household have to be quarantined?
Absolutely. So because you can be contagious 2 days before you have any symptoms, anyone that is a direct contact of someone needs to quarantine to make sure that they don't have symptoms. In a household, there's 2 ways it kind of works in a household. If you can separate out the person that has COVID and have them stay in their bedroom, someone else cooks for them, they use a different bathroom, then your quarantine date would start the day that the person separates out. So say you found out that your cousin tested positive today that you live with, and you wanted to separate them out right away today. Today would be the last day that you had contact. Today's the 17th. So tomorrow would be the first day of your 2 weeks. So then you would stay home in your house away from your cousin who has the COVID for 2 weeks. Then you can leave at that 2 weeks. If you don't have the ability to separate, or especially if it's a young child where you can't just stick them in a room and separate because they need to be cared for, then your quarantine date would start the last day that that person is contagious. So say you found out today and they were they're on isolation until the 24th. That means that your quarantine would start the 25th. So then you'd be quarantined 2 weeks from that date. So you could potentially be stuck in your house for 21 days, 21 to 23 days. So if you can separate, it's beneficial for everyone else in the house. That way you're not stuck at home that long.
Okay, that's it. Ooh. With the new rules coming out for from CDC all the time, what is the latest on like social distancing and when to wear a mask?
Right now, because the prevalence is so high of COVID, we're saying that you should wear a mask anytime you're in direct contact closer than 6 feet with anyone that does not live in your own household. So if you're going to your friend's house and you don't normally see them, or even if you do normally see them, you should wear a mask. Because what I'm seeing right now is spread between friends and family who feel like those people are safe. So it is usually one person brings it in, and then everyone thinks that they're all safe because that's their close family or friends, and they see them all the time. And that one friend gets 4 or 5 people sick. So yeah, anytime you're not with your immediate household.
Okay. So when in doubt, just wear it.
Absolutely. Like out for groceries. If you're giving someone a ride in your car that doesn't live in your household, you both should mask.
Okay. Another question from the audience is, what about if a household member is waiting for test results? Should the other members of the household quarantine until the results are back?
If the other person is sick, yes. If they went in and got tested because they'd been exposed, but they have no symptoms at all, then no. Once that person has any symptoms at all, then yes, you should quarantine.
Says, do you know if there's a plan in case there's something, positive case at the school?
Absolutely, they have a plan. So what happens is they would look at when the person was in school, the case was in school. They would look at when they were contagious and in school. Then they would go back and figure out who they had contact with, other kids, other staff members, and then those people would be immediately notified, and they would be sent home with information on how to quarantine and for how long, and testing information.
Let's switch it up a little bit. We do have a couple of questions for Simona. Let's
Okay.
see, what did all right, here, look at my notes here. Let's see. I guess one of the main questions I'm seeing for you would be regarding RTG workers, and they're wondering why a person on their probationary period does not is unable to work remotely as some of the other seasoned staff, and they're just wondering why that is.
Okay, so previously with our telecommuting policy, that's all we had, and you had to be through your introductory period. Just recently, we came up with the remote work agreement, which is temporary for pandemics, natural disaster, or other extenuating circumstances. And this policy allows a hybrid version for new employees. So they'd come into the office maybe 2 days a week and then work at home the rest of the time. This is kind of why we did it, because the telecommuting policy, it was more for like a long term. It wasn't meant to be temporary, the telecommuting. So we now have the hybrid, or we have the remote work agreement, and that was effective November 12th.
Oh, nice. And then there, just another one for you, because I know that you handle a lot of the COVID assistance programs.
Mhm.
Can you kind of go over the current COVID assistance programs that you handle or you know about?
Okay,
that people
so
can
right
apply
now
for?
the only one that we have that's under me is the safe shelter, and that deadline was extended to November 30th. It's for, there's 2 age brackets. One is, I believe, 50 and up, and you don't need a doctor slip if you're in that bracket. If you're 18 and over and in that bracket, you need a doctor slip that says, based on CDC guidelines, this person is at high risk. That's one form of documentation. You need the quote saying what you need. You can only get 2 items. it can range from a mattress set to a generator to a stove, a refrigerator, washer. And then you'll have to provide the quote for that and kind of a little statement as to why you need to replace something. It also handles the weatherization, if you need weatherization. And for that, you can reach Ed and Mitz or Gabby at the government center. But the deadline is November 30th. It needs to be postmarked by then.
Okay. So for the Safe Shelter program, it doesn't go by income?
No, there's no income guidelines. It is one per household. So 2 people at the same household can apply. Just one.
That's cool. All right, I'm looking, I don't see any other questions. Let's see if I can come up with some. I don't have any other questions prepared for Teri. Is there anything that, Teri, that you think that the audience could be reminded? Just something really simple that, reminding them to do something or check something?
I do think the biggest reminder is to assume that everyone you come in contact with outside of your immediate family has it. So that will keep you safe. It will keep you always thinking, I'm not 6 feet apart. I need to be 6 feet apart. At this point, the last data I saw post yesterday was in St. Louis County. If you're in a group of 10 people, your chance of having someone that has COVID in that group, it was like 31%. So that means, say you gather with people 3 different times during the week. One of those times, you're probably going to run into someone that has COVID. I think it's really gotten bad. So if you guys pay attention to the numbers, we've been between 7,000 and 8,000 cases a day. A month ago, we were sitting at 1,200 cases a day. So if you think of that in your head, we've times by 4, 5 almost how many cases we have per day. Yes, we are testing more. We are. But we're seeing way more positives than we were before. Almost every case I see is linked to a bar or a restaurant. Almost every single one. Then that 1 or 2 people that were exposed in the bar or restaurant, they then go to a family gathering. And they're in a group of people that they're safe with, right? They're comfortable with, but they were exposed at the bar last weekend, but you don't know that. Then you have a birthday party and then you gave it to your grandkids, your kids, your grandma. That's the kind of spread I'm seeing, is they got it. I can almost always track it back within 2 or 3 cases back. Someone was at the bar. The reasoning behind that is, if you're drinking, you're not as aware of keeping your distance. You tend to sit closer, you tend to laugh louder, you tend to talk louder. When you laugh louder and talk louder, what comes out of your mouth sprays further. I know that sounds nasty, but it does. And those little droplets that you can't see, you're spraying the person next to you, or the person is, if we call it aerosolized, so it gets in the air and it travels farther. That's where we're seeing the spread. That's why the governor is putting the kind of the lockdown on bars and restaurants. A lot of people are really upset about it, but I saw the best meme ever. It said, if the new lockdown guidelines from the state are impinging your lifestyle, you're the problem. You're part of the problem. You're who those new guidelines are put out for. We really need people to not go to the bar, not go to your friend's house and have a party with 10 people over. We're getting to the point where you need to assume at least one of those people and those 10 people that you're drinking with has it. We saw a lot of spread from Halloween. I'm seeing a ton of spread from deer camp. That's more common in the non-native community. That's where I talked to one of the clinic nurses today, and that's where they said they're seeing a lot of cases from deer camp. So people are gathering, people that don't usually see each other, they're having some drinks, they're really comfortable with each other, and we're seeing that spread.
Well, we do have a question, Terry. I'm not sure if you'd be able to answer this one or not. But the question is let's see, is there any set threshold of positivity or other measures of spread that will trigger the closure of the offices and or the casino?
We talked about that one a little bit today. I'm not the decider of that decision. The tribal council is. I think what we discussed would be if full departments are closed, which we hopefully aren't, because departments should be practicing that social distancing among themselves. We shouldn't, if there was a case, I'm going to use my department because I know my department. If one of my employees comes down with it, they should have one, if that. You shouldn't be having contacts, because we should know now that we can't gather. We can't, if I go down and talk to my staff, I'm standing 6 to 10 feet away with a mask on every time. We're doing most of our meetings in Zoom. If you didn't notice, all of us except Eddie are at home because we cannot be in the same room. If I was in the same room, but I would have a mask on and I'd be sitting at least 10 feet away. So back to the question we've talked about with the tribal council, it's hard to know. I know if we see a lot more spread, we're going to talk about it more, but we don't have a hard set guideline. Even the Minnesota Department of Health, I've been on lots of calls with them on the work site. Their job isn't to come in and shut us down, which Minnesota Department of Health can't come in and shut us down because we're a sovereign nation, so we don't necessarily have to follow state guidelines. A lot of times we choose to follow state guidelines just to make sure that we're doing the best thing for the community and our employees. But if we had a cluster, they're calling it a cluster of cases, which is more than 5 employees within 14 days, MDH would call me and they'd say, hey, are you aware? Do you need any help? They would walk through with us what mitigation, what ways we're using to stop the spread or what we've worked on. They'd ask if we need any education, if they need help, if we need some guidance, but they are really truly working on trying not to come in and shut anyone down. So with each case, we're learning more. I know there's been a few cases both at the tribal government and at Fortune Bay. The case investigation is done on those, and then we do contact tracing immediately. The people that have contacts with the employee are sent home on quarantine. They're talked to, they're given information, and then they're sent home on quarantine. With each case that we've had, we've looked at what worked, what didn't, what do we need to change, what can we do differently next time. Honestly, both times we've had cases, well, at both places when we've had cases, we've had very few work-related contacts. The most of the contacts that they've had have been off work time, lunch, they rode in together, carpooling, which we're not recommending that you do right now, if you can all help it. So yeah, we don't really have a hard set rule. We just, with each case, we try to work on what we can do better. It's probably a non-answer, but that's the answer.
No, that's good. That's, wow. Yeah, because I understand too that I know that the council is monitoring that and is in constant contact with the Fortune Bay almost on a daily basis. So let's see, I don't really have any other questions coming in from the audience. Let's see. I suppose I could ask Simona one more question. What time it is?
Yep.
Simona, this is, question is like, what type of assistance or help is there for employees who test positive or have to be quarantined? I think Teri mentioned we could be home for almost 21 days.
So right now,
do we have any?
we have the emergency sick leave that is effective until December 31st. That is, you apply for it, you get 80 hours of paid leave. And then after that, right now if they need more than that, and if it's, for some employees, if it's due to childcare issues, if like the childcare shuts down or whatever, the EFMLA, the expanded FMLA is there for them. If they run out of the emergency sick leave, we have other options that we're gonna run through, but we gotta go through the CHIRC committee first. So should they need up to more than that, there are options.
That's good to hear. So I know that there was some questions on that. Let's see, we did have a new question here. It says, what if you see someone a couple of different times in a day and it's less than 15 minutes? You were wearing a mask and you were 6 feet apart and they get tested and have COVID. What are your chances of exposure or having it?
Okay, so your total contact time, so MDH has changed their wording a little bit. They're saying 15 minutes cumulative over a 24-hour period. So if you saw someone 4 different times for 5 minutes apiece within 6 feet, I know this isn't the question, but within 6 feet, then that makes you a contact. But if your total time is less than 15 minutes and you both were wearing masks and you're at 6 feet, your chance is not good. We would not quarantine you. But remember that the COVID virus doesn't like hit 6 feet and stop. So there's always a small chance. I'm not going to quarantine you. We're not going to quarantine you, but you need to be vigilant for yourself for symptoms. The last probably 3 people I've talked to in the last few, well, not the last 3, but in the last couple weeks, there's some that have no idea where they got it from. None. You know, you try to walk through where they've been, and a lot of them are bar contacts. Not everyone, but you know, you try to think through if it was or not, and it's hard. That's kind of like the guidelines they put up. Could you have got it from them? The chances aren't good, but I can't guarantee that you wouldn't. if that makes sense. Your risk is a lot less if you're that far apart, if you keep your distance, if you limit the amount of time you're talking to them, and you both have masks on.
Okay, so kind of extending on this question is, say for instance, two employees are usually 6 feet apart, but like you said, you can accumulate up to 15 minutes throughout the day. So if they go to that person's, help them on their computer or help them, with something that's a little bit closer, over 15 minutes during the day. And one of those do get sick, are you considered a close contact then? And are you quarantined, or?
Yeah. If
how does
you've
that work
had,
there?
if it's been closer than 6 feet, and say you needed help on a report and they came and sat by you for 5 minutes in the morning and they were right here, then you saw them in the break room and you talked to them over coffee for 5 minutes. Once that hits 15 minutes, that's your 15-minute total for the 24-hour period. So then you would be a contact, masks or not, unless you're a healthcare worker. Healthcare workers are different. They have the N95 masks. They are fit tested. How the fit testing works is you go in a room with, I think they have negative or positive ions, and they have a machine that goes in your mask, and it tests if those ions are getting in through your mask. So it's sealed. An N95 mask is not effective if you do not have it fit tested. I see a lot of people wearing them and they just bought them at Menards or they ordered them off the internet. Unless you have that fit tested, you're just wearing a surgical mask. I mean, yeah, it's probably a little bit better, but it's not a true N95 unless it's fit tested. Sorry, that was a little distraction. Could any boys for an employee? We don't have the equipment. You could, on your own pay, I would think, go and you could call Essentia in Virginia. They have the fit testing. We have to send all our healthcare employees there. But you could, you'd have to probably pay for it on your own though.
Okay. So as long as we're talking about masks, I know some people are wondering about the gaiters. Because before they were saying the gaiters were so-so and go ahead, you can wear them. Now there's kind of leaning towards not wearing gaiters. What do you suggest?
The gaiters usually one ply. So there's usually just one, and have you ever worn, they're super thin. I think they are. They're super thin and it sits right on your mouth. So when you're breathing in and out, in my own opinion, it gets wet and you're not supposed to wear them once they get wet. Because then if viruses or bacteria get on the outside, it wicks through easier. I personally don't like them. They're uncomfortable for me and I don't like to wear them. I don't think they're as effective. My own family and people that ask me about them, no, I wouldn't buy them. I don't think they're effective. The same thing goes with face shields, eye shields, face shields. That is not a good substitute for a mask. Those are meant to be worn with a mask underneath. They offer you and other people around you without a mask very little protection, very little. Because most of them come, just below your chin. When you breathe in, air goes up under that into your face. You have no protection. And when you're talking, when you have a mask on, it's contained, right? If you just have the face shield on, you're talking and it goes out and around you. They are not a replacement for a mask. And I think a lot of places we're seeing that they are not allowing them to wear them. I know it's been, I think, a couple months since we switched, especially at Fortune Bay, they were allowing them. And then when the new data came out, and the new studies had come out, we recommended that they stop letting people wear them. So then they stopped letting people wear them there.
Well, there are some questions that are coming about current cases or pending cases on the reservation. Do you have information on that? Are you able to share some of that or that data? Teri. I don't want to have to say it.
You're
Can't
muted,
hear you,
Teri.
Teri. Do you see? Or are you looking up information? Yeah.
Sorry, I had to look. Right now, currently, we have 8 active cases on the reservation. I haven't had a new case on of someone that lives on reservation, I think, since Friday. I have been doing case investigations because we are doing some that live off reservation that are band members or have close ties to the reservation. So I have been doing some of those both yesterday and today. But yeah, that's what we have right now. I do put out a case announcement every day. It usually posts from the day before in the morning sometime. And those are usually on the website and then also the Facebook page.
Can you kind of explain, say for instance, if I had tested positive and you're going to do a contact trace with me, so you would call me and then what would you say to me?
Okay, so I would call you. It's usually at least a 15-minute call, depending on how many contacts and how many questions people have. I've spent up to an hour on the phone with people. I ask you when your first symptom was, and we need that to be accurate, because that's what we base all the times on, of how long, when you were first contagious, how long you need to stay in quarantine. And it's really, really important that people tell the truth, because if we let you out of isolation too early, you can infect other people when you come back. I've seen that. So it's really, really important that you give me correct dates. So if you say your symptoms started on the 10th of November, you would be contagious 2 days before that. So I would ask you who you had seen and where you'd been since the 8th. So that would be who your direct contacts were. Who you spent more than 15 minutes closer than 6 feet with. Who do you live with in your household? The majority of the time, every person that lives in your household is a contact, unless you have like a cousin that sleeps in the basement and uses a different bathroom and you never see because they work night shift and they sleep all day, or you know what I mean, something like that. So we would go through who all your contacts were. I usually get information about the contact if they have a phone number, because I usually need to call the contact and let them know that they're quarantined. So then we keep track of that in what's called the meds. It's the Minnesota system. We use the same system that the rest of Minnesota does. We plug all the information in there. I plug all the contact information in there. We also track where you've been the 2 weeks before you got sick, because we want to see where you picked it up from. So I'll ask you if you have anyone that you've had contact with in the last 2 weeks that has been positive. I will ask you if you've been out to eat at any restaurant, not takeout, not went in, got food to go and left, but actually sat down and ate. I'm going to ask you if you've been in any bars, because I'm seeing, like I said, a lot of cases linked to bars. So I'm going to ask you that. I'm going to ask if you've been to any community events. Some of that is we want to be able to track. So say you had a funeral. Say you had a funeral on, I don't know, last Saturday. And this week we see 4 cases that all went to that funeral. Then we can kind of connect that, gee, maybe someone at that funeral had COVID. So like that kind of information, we want to see where you got it from so we can kind of track down the rest of the people that maybe would have it. Then I would give you information about if you're sick, how sick are you? When should I call the hospital? What kind of side effects would I have? One of the big ones I've been talking about is COVID is known to cause clotting disorders. So I talk a lot about, especially if you're over the age of 30, what a heart attack feels like, when you need to go in, if you're short of breath, if you have an oximeter, what level do I need to go in at? That kind of information. And then we talk about that you need to stay separate from everyone, what isolation and quarantine really means, and how long they have to stay home away from everyone. And then I usually talk to them, if they live on reservation and we're going to provide them essential services, we'll ask, do you have someone that can get groceries for you? Do you need medications delivered? Do you have any doctor's appointments coming up because you need to cancel them? That kind of stuff. So it's not a fast conversation usually.
Okay. Well, as long as we're on that topic, another question that came in is, what if you knew you had been exposed but never got a notification from like you or the MDH?
You can call me. People can call me. A lot of times people think they're exposed and they're not, because either they don't know the right dates that the person got sick. I get tons of calls. I saw that person last week. You are not a case. You are not a contact. Sometimes I've found, especially with young kids, teens to 20s, they couldn't tell you who they saw in the last 3 days. They have no idea, or they don't want to tell on people because they don't want to get them in trouble. I see that a lot. Especially boys, they have no idea who they saw or where they went or when they went out to eat or who they were with. Yeah, that's hard. But if people have questions, they can call and ask me, and I can let them know yes or no if I did the case investigation. If it's on the state side, a lot of times they're depending on the case to contact all their social contacts. So if it's an off-res case that we didn't do the case investigation on, the case itself is supposed to notify their social contacts. So, I mean, I guess you could be, if it's someone off-res and they just didn't get a hold of you. If you think you're a case or a contact from someone, you could call and ask me. If they're off-res, I won't be able to look them up. But you could always contact the case and ask, when were you contagious? Remember, I saw you on Saturday. Do I need to quarantine? Ask them. They should know after their call with either me or someone from MDH when their contagious date was.
Good one. Another one is, I'm not sure if you've seen that or not, but can animals actually get COVID?
I haven't actually seen one, but I guess there has been a couple cases of cats from what I've seen on the news. In the information that we give out from MDH, it says if you are a positive case that you should not have direct contact with animals. Have I seen it? No.
Okay. Hey, Simona, we got another question with that regards to employees. The question is that can employees still travel out of state? Has there been any new restrictions or anything like that?
There is no new restrictions yet. Nothing yet. There is no restrictions on state travel or anything. So they're free to go wherever they want. Just make sure they practice all the social distancing and wear their mask and all that good stuff. And they don't have to quarantine when they
Okay,
come
so
back
they're-
either.
They don't?
No.
That's cool.
I'm going to make a comment on that one. COVID is everywhere. You can get it visiting with your friend next door. There isn't really a difference. There's a difference in the behavior if you're being conscious about it, keeping your distance from people, but it's everywhere at this point.
I know according to a few of the news sites that I followed, and they had mentioned that for the upcoming holidays, just to be safe, they were saying you should maybe, if you have to go, to quarantine yourself for 2 weeks before you go to that gathering, just kind of help make sure that you're not contagious when you go. Terry, do you have any other suggestions for people that wanna participate in Thanksgiving or Christmas that's coming up?
If you're going to gather and not follow the recommendations, you need to quarantine ahead of time. And then you need to be extra cautious for that 2 weeks when you come back. You should be very aware of not spending time closer than 6 feet for anyone, especially at work, because you don't know if everyone else at the dinner quarantined before they went too. So the recommendation that the governor put out yesterday was that you should not be having Thanksgiving dinner with anyone outside your immediate household. I know a lot of people aren't going to follow that, but your small circle isn't as small as you think it is. So if you only see, so I'm gonna use my own family. If I was to have Thanksgiving dinner, which I'm not, if my mom and my sister would come. My mom lives alone. She goes very few places, except she does go to the thrift shop and cook, right? She works there. So how many contacts do you think she has there? At least 5, right? Then my sister works from home. She lives in the cities. She goes to the grocery store. Probably that's about it. My nephew, on the other hand, works at Culver's, has contact with staff. He works fast food. Fast food people are not able to separate out more than 6 feet. So he probably has at least 10 contacts at work, right? So my family and 3 other people gathering, I'm actually exposing myself. That's not even counting my kids. I'm probably exposing myself, just my 5, maybe 2, 1 or 2, and 10, at least 15 additional people. Not even counting my own kids at school. If you have a kid at school, they're exposed to at least 30 people every day. So, your small gathering just got to about 50 people that you've then been exposed to if one of them has it. So, I know it's not fun. My mom is literally spending Thanksgiving alone this year. So I have a kid right now that's on quarantine from a contact at school. My mom, yeah. Yep. It's not ideal, but that's what you have to do.
Yeah. Oh, But like they, a lot of people are saying though, is like, just kind of keep your distance this year so everyone can get together next time. It's a lot going on. So we're gonna about wrapping it up here because we've been on for about an hour. And again, you're always welcome to give Teri a call. All of her information and contact stuff is on our website at boysfort.com. Let's see. And if you're unsure, just go ahead and call one of the clinics. I believe what is the numbers for Nut Lake is 757-3650. And the Vermilion Clinic is 753-2182. Wow. Trying to remember numbers. I do want to say thank you for joining us. Thank you for asking questions. This is going to be available as a replay to watch at a later date. And I would say if you're able to go ahead and share it with your friends and family, just so that maybe they can pick up something that they didn't know or just have a good reminder of stuff that's going on. And then Teri does send out daily case reports. That's also available on our website at boysfort.com. We also share that out to our social media. So you can look on there and just keep track of it yourself if you want. Let's see, I think.
There was one more question on YouTube.
Oh, I missed one. You see that, Teri? It says, you would think coming back to the reservation, you would want people to quarantine for their safeties and others.
That was.
I think I'm going to kind of answer that as that would be optimum, right? I mean, if you go on vacation and you come back, if you can quarantine yourself, that would be awesome. But I know a lot of people aren't able to do that. But to, like Teri mentioned earlier, to be extra cautious when returning. Does that sound about right, Teri?
Yeah, I think it's important too, but we're exposed every day. Like you're exposed every day you go to the grocery store. You're exposed every day you visit with a friend. You're exposed every day at the drugstore. You can't quarantine every day. So I just want to be clear with that. It's the behavior when you're out. It's making sure that you're 6 feet away. It's making sure that you wear your mask everywhere. We dropped the quarantine because we're exposed every day. And it's the behavior. So we're encouraging people to make sure that they're conscious of who they're by and how much time they're spending. That's what we're doing.
Thank you, Teri. Thank you, Simona. Appreciate you sitting in with us. So as we wrap it up, again, like I said, you can share this out with friends and family. It'll be on our YouTube channel for review. And if you have any questions, go ahead and feel free to contact me or Teri, and we can try and answer your questions as best as possible, or at least direct you to someone who can. So with that, I guess we can start to say goodbye. Have a good evening. Again, if you have any questions, reach out to us. All our contact information is on our website, boysfort.com. And we shall see you guys all next time. Thank you. Be well, be safe. And
Have a good
remember
night.
to wear a mask.
Have a good